Hello, it's Tune In Tuesday, and we are here on YouTube and here on TikTok. And so I'm glad to be able to be here live. I have been working the last 2 weekends. 2 weeks ago, I was in West Palm Beach at the spring meeting of anti-aging and regenerative and functional medicine. And then just last weekend, I just got back late last night from Mexico City and speaking at the ninth Congress of Integrative and Functional Medicine. So super cool to be in another country. Some of you may know that I'm half Puerto Rican, but shockingly, my Spanish is not very good. Not shockingly, my mother just didn't speak to Spanish to us when we were growing up because my dad is from India. So Spanish wasn't our primary language, but I've been working really hard on my Spanish the last 3 years because I actually spoke at this conference 2 years ago. So I spoke on Saturday about biohacking and perimenopause. The doctors were really receptive of that lecture about all the different types of testing. Lately, I've been asked to speak a lot about the different types of testing. So a lot of questions come here on my lives about what testing to do, what to test. So if you haven't checked out our new free resources right now, check the link in my bio, download our brand new free guide to parent testing and perimenopause. And if you're on YouTube, the link is in the chat. If you're not already signed up for our free newsletter that comes out on Tuesdays, please sign up for that. That is free. We've been trying to do that. And we have a free mini course that you guys can check out. So lots of new things we've been working on. We've got somebody helping us with our graphics. That's not my forte. So I spoke yesterday or this weekend about testing in perimenopause. I spoke about breast cancer and estrogen detoxification. And I also spoke about sex. I talk about sex and sexual dysfunction and all the things that can help, and had a case study on how we help our patients that have low libido. So, like I said, if you're not following me here, please give me a follow. Head on over to YouTube, Tara Scott, MD. Check me out there and subscribe. We're trying to grow that subscription to that channel. And also follow me on Instagram, Hormone Guru MD. I come on here live on Tuesdays. And one more thing about Mexico City that I wanted to tell you is that it was so interesting. On Sunday, they shut down this main streets and they had a race. And I kind of felt like, oh my God, how is there a race here that I'm not running? But I was like, every weekend they have a race. There was a 5K and a 10K. I don't know if it was longer than that, but it was really encouraging people to be active because, Hispanics have an increased risk of diabetes. A lot of the food is like corn and, like very carb heavy. So I thought they opened this race up and then they have these bikes, that you have to rent, like those city bikes. Tons of people were exercising. It was amazing. So that was pretty cool. That was what I've been doing last weekend. The weekend before, I was in West Palm Beach speaking to a bunch of doctors there. What did I speak about then? I think I spoke about testing again and breast cancer. It seems like that's what I talk about a lot. So I am here. We've got all those free new resources for you. And if you have some questions we can answer, I'll be on here for about half an hour. I apologize to you guys if you were on last week. You were asking like, why can't we hear you? And here the microphone was on my sweater, and I had taken my sweater off. All right, C. Barton, you're right. You're the first question. So, am I still seeing out-of-state patients? So, that's a great question. During COVID, the laws of telemedicine had relaxed. But as of September in Ohio, they went back to the former guidelines, which I have to follow the state of Ohio because that is where my licensure is, and says that in Ohio, we have to see patients face to face first. So, yes, patients have to come to me first to be able to be seen. See, why does progesterone make me depressed and bloated? That's so interesting. So first I'd want to know, is it actually progesterone? Or is it a synthetic progestin like in a birth control? There's a little bit of a difference, and the synthetic versions do have an increased risk of depression. If it is micronized progesterone, there are a few people, a very small percentage of people, that they turn progesterone, which kind of stimulates the GABA receptor. GABA is like Xanax or Ativan, like your chill out. They turn that into glutamate. That's an enzyme that turns it in, which is excitatory, and people feel agitated. So I'm guessing if you're talking about taking micronized progesterone, that your body must be doing that. Oh, you are talking about prometrium. Okay. So that's probably what's going on. You might do better with a slow release form that is compounded for you, and it could be the dose. Upsidaisi, I just started 1 milligram of estrogen. It made me feel really anxious. Upsidaisi, that's not a low dose at all. And if you're taking it orally, that could be part of the problem. We don't give oral estrogen because it actually interferes with the way your body makes serotonin, which is your calming neurotransmitter also. And wondering also, Upsidaisi, if you actually also are taking progesterone, because that helps as well. So it's a lot of times can be dose related. We would usually start people on a much lower dose, and we would also start them on a transdermal. Okay, Julie Van 70, my testosterone. I think you cut off here. Sile White, what does bleeding before progesterone withdrawal while on cyclic HRT mean? So cyclic HRT is if you are taking progesterone, your body's going to do what it's going to do. And so if you're bleeding before, it usually means progesterone's low, but the HRT is not strong enough like a birth control pill to make you bleed at a certain time. A birth control pill is strong enough to suppress bleeding, and then when you stop it, you have what's called a withdrawal bleed. But if you're on HRT, and if it is bioidentical progesterone, it doesn't force your body to have a cycle. So that could be part of it. Betty Garcia, I just started HRT. How soon will I see any results? In general, we tell patients it takes about 90 days to assess a hormone dosage. Especially if you're still cycling, it could take a while. Some people notice some things right away within a week or so, but for a full evaluation, it can take longer than that. Okay. C. Barton 1721. Any idea on the cost of the visit? Actually, I don't know because I don't own the practice anymore, but all of the prices are on our website. So you could check out Forum Health Akron, and we have, 4 different providers that you can see for different levels of entry. So I don't have the prices memorized. Sorry. Julie Evans 79. My testosterone overall was 13. Overall is 13, was 26. My cortisol is good. I'm 45. So testosterone, if your total testosterone is 13, depending on your lab, if that's a total testosterone, usually it's 16 to 55. So that's a little bit lower. Sherry, you recommended estrogen or progesterone or testosterone. You recommend estrogen or progesterone or testosterone. So, Sherry, we do use all 3 of those in our practice. Estradiol is the bioidentical form. Sometimes we use Bias, which is a combination of estradiol and estriol. Micronized progesterone is progesterone. Make sure it's not progestin. Make sure it's not levonorgestrel or Provera. And yes, testosterone. So we do that in our practice. Amazing Ezel. Are the other doctors in your practice as knowledgeable as you? Thinking about making an appointment. So I have handpicked and hand trained the other providers in my practice. I have 2 nurse practitioners and a physician's assistant. And so to be honest, I've been doing this for 20 plus years. So I'd have to say, no, they're not as knowledgeable as me, but they are very knowledgeable, very compassionate, very good. And we've gotten really good feedback from them, and they're wonderful. Natalia, does low estrogen cause thinning hair? Yes, estrogen does, and hair grows in 3-month cycles. So whatever happened now is 3 months ago. So if you're, skipping, that could be part of it. But yes, definitely have noticed when my estrogen is low, it's not even the loss right around in here. You can still see like I have all these like hair growths. The texture totally can change. Like it can be very, very dry. D, put on HRT at 61. 2 weeks later, I'm bleeding again. I'm postmenopausal. D, I'm wondering how long you've been on HRT, and sometimes within the first 3 months, you actually can have some breakthrough bleeding. So it should not persist. So hang in there. But it should not persist. And it could be the dose, could be your body adjusting. Ups to Daisy. So you say I'm taking progesterone or Northindrome 0.35. So that's actually not progesterone. That's a progestin. And I think Ups to Daisy, you were the one that was saying you were taking estrogen. So you're taking oral estrogen, and you're also taking a synthetic progestin, which is not bioidentical and does increase the risk of depression and also has made people more anxious, and an oral estrogen. So, not my favorite combination. One of the more older recipes for hormone therapy. Ariana, are estradiol injections better than patches? Been on the patch for 3 years. Actually, I think, Ariana, that the patches are really good because they give you more of a constant release. And think about your ovary. It doesn't give you a burst once a month or once a week, even. And anytime you have an injection, you're getting a high amount and then a low amount. So you're not getting what we call physiological, which is you would get a little bit constantly. That's how your ovary is meant to work. Amy Santiago Torres, I'm doing the pellet therapy. What are your thoughts? Well, first of all, progesterone it is not available as a pellet. So hopefully you're taking progesterone in a capsule form. I think some patients do well on pellets. It really depends. I think I am trained to insert them, but I don't do them in my practice because I haven't seen the dosages to be good. And so, but I think some people, like, once you know how they metabolize things, sometimes it's a way that people feel really great. So it really depends on the dosage. So some people, and I think, I wish it worked, if it works well, it's so carefree. You don't have to take something every day. So, and it's not oral estrogen. So that's good too. So there's definitely some pros of it. And if it's used right and monitored correctly, it can be good. In my practice, though, a lot of patients want to use their insurance for their medication. So my patches are covered, micronized progesterone is covered, so they don't have to pay out of pocket like you do have to pay out of pocket for the pellets. So that's another reason that we don't do them in our practice. Amazing, Edel, can menopause cause stomach issues or lightheadedness, eye pressure? So the first thing, yes, there's actually been data that your microbiome and the bacterial balance in your gut does change with the drop in estrogen. So number one, yes, you can have stomach issues. Number two, lightheadedness and eye pressure, that is common as estrogen drops. So I did experience that too, and I didn't know what was going on, but yeah, that could be something. User 5934658, I'm getting palpitations and checked a cardiologist that said tests were normal. What is good to take? So palpitations, depending on how old you are, can be from cortisol. They can also be from estrogen swings, the lack of progesterone. L-theanine can be very helpful for palpitations. Magnesium is something else that can be helpful. Depends on if you're actually having like anxiety with it or not. Julie Evan, when do you recommend starting HRT during perimenopause if you're having lots of symptoms? That's a great question. So I started my progesterone at age 38. And I didn't need estrogen till, many years later. So it really depends on the person, if they're still cycling, what their levels are. But we are usually starting progesterone first rather than estrogen. Looks like there's a question on YouTube. RN7375. Can I use my progesterone capsule vaginally so it's not systemic? Well, there's a couple answers to that question. The capsule is actually formulated to get through your acidic stomach. So the preparation of how it's made as a drug is not it's not to be dissolved in the vagina. So usually you would make something different if you wanted to be dissolved in the vagina. And so taking progesterone vaginally, yes, we can make sure it gets to the uterus, but part of what we want the progesterone to get to is to protect your bones, is to protect your brain, is to protect your breast, because the estrogen is getting to your breast, and estrogen causes breast tissue to grow, and then you're not getting the progesterone to the breast. So I'm not a fan of that particular mode of taking it unless you're not taking estrogen and you're just trying to protect your uterus from bleeding. So RN 7375, if you're not on estrogen, it could be okay, but again, that preparation that is available is not meant to be dissolved in the vagina. Mary Miles, how do I know when it's time to increase estrogen? I'm 0.075, having bouts of extreme fatigue. So it is true that fatigue can be because of low estrogen. Also wondering what your progesterone level is, your DHEA, DHES, and testosterone, because that's a pretty decent dose of estrogen, but it wouldn't be unheard of for you still to be low. So normally what we do, Mary, is we would check all your levels of everything and then make an assessment based on that. Of the things that can affect your energy is cortisol. I wonder if that's been checked, and your thyroid as well. Ariana, are there any specific levels of estrogen that support hair growth, lower versus higher? That's a great question. There was recent publication about bone health, hot flashes, heart health, but not about hair growth. I would have to say, extrapolating that, most people feel best between, let's say, 60 and 100 of estrogen, estradiol levels. So I'm going to guess that hair is going to be better in that range as well. But I don't think that's actually been studied and documented. User 2400, can hormone problems cause venous reflux disease? That's a great question. Are you talking about valvular issues like in your legs, like varicose veins? Are you talking about in your heart? I'm not sure, user 2400, what exactly your question is. Um, Ups to Daisy, you prefer the progesterone capsules and transdermal estrogen or injection? Um, so, ups to Daisy, to answer your question, most of my patients are on transdermal estrogen, either in a patch or a gel or a cream. So, yes, I prefer that to be transdermal. And just again, because many of our patients are able to use their insurance to pay for this medication. And so, my goal is to provide as much care as we can. And, if you have insurance, to be able to use that. So, that's mainly why we have that practice pattern. And the progesterone capsules. Although some of our patients do take progesterone as a troche or as a cream, depending on their situation. Okay. Thank you for sharing the live, guys. Okay. Letitia Comunes, Ham. I cannot lose weight on calorie deficit. Ugh. And you tried Wegovy for a year and no? Okay, Letitia, that makes me wonder if it's your hormones, because usually if you're balancing your hormones or taking your hormones and then you take the Wegovy, our patients have had great success for it. And they're saying that those medications are more successful if you're actually on hormones. So I'm wondering if that's a missing piece here, Letitia. I'm wondering if anybody can get your hormones checked, because that's too bad. And it's not caloric restriction. It definitely will not, that does not help in menopause. So I definitely would want you to get you assessed. Okay, user 2400 says in the legs. That's a more uncommon question about venous issues in the legs. In my experience, it's more related to, I've had thin people that have varicose veins. A lot of times, it can be induced with pregnancy when you have more venous flow. But some people have varicose veins and don't have any issues with the blood volume. It seems to be a genetic issue about the valves, but I don't know if it can be made worse from having less hormones. That's a great question. I don't know that I've seen any data on that. Jennifer Myers, what do you recommend for lowering cortisol in addition to stress reduction? Yeah, I used to say stress reduction for lowering cortisol, but what I found out is there's always another stress, right? You can't always control your stress. So, what you have to control is how your body responds to stress. So, what works for you? Is it Netflix? Is it going to bed early? Is it going for a walk in nature? For me, being out in the sun, being out running with my friends, although running can increase your cortisol. So, yoga has a lot of data behind that for stress relief. Breath work, breathing, 6, 7, 8 breathing when your inhale is shorter than your exhale, heart rate variability, heart math. I've been studying, I have to recertify my integrative medicine boards on Friday. So we have to know which one has the most data behind it, which intervention, a lot of mind body things. So Jennifer, you just have to find what can you be consistent with? What can you start? Can you do meditation? Are you going to do it? Is it not for you? And what works for you? Jen Av, do you think cancer patients should avoid estrogen? Well, that is a very loaded question, but I will say in general that the Menopause Society position statement in 2024 says that non-hormonal therapies should be done first for breast cancer. And if they have persistent symptoms, it doesn't say don't ever give them hormones. It doesn't say it's an absolute contraindication. It says under the discussion with your doctor, your oncologist, it may be an option. So never does it say don't give it to it. So it really depends on the patient. So we treat everybody individually. So Letitia, I see that you did ask your primary care. So your primary care isn't going to know how to check your hormones. Make sure you download our free guide that we just put on. The link is in the bio on what to test and how to test. Because if I'm not taught as an OB-GYN, I guarantee your primary care doctor has not been taught about hormones unless they've done extra training. Maybe they have. Lena Shekor, what is the best natural treatment for menopause you recommend? So it really depends what symptom you're on. Are you talking about bone loss? Are you talking about heart health? Are you talking about sleep or hot flashes? So are you talking about symptomatic treatment? Or are you talking about overall wellness? So for hot flashes, a supplement with rhubarb has been helpful. Saffron has been helpful. Evening primrose oil, fish oil. So it really depends on what the symptom is. The same supplement is going to help all the all the symptoms. Style White, how exactly does progesterone, part of HRT work, and it continues very cyclical, is one safer? So normally when people are still having cycles, we respond to the patient's cycle. We don't force them to have like a 28-day cycle and give the progesterone a certain amount of days like you do with a birth control pill. That forces you into a cycle. So we just have them take progesterone and stop it when their period starts along with their estrogen. And so it's not that it's not safe. It's just that your body builds up a tolerance if you take the same thing every day. And so that's one reason why we stop it if you get a period. Also, we're trying to mimic what your body is doing. Nami's wife, the last day of my period to the next, I get much vertigo, fatigue, and weakness, but during I'm okay. Yeah, interesting, Nami's wife. So if that's happening after your period, what it means is the next egg hasn't taken over yet, and that estrogen isn't increasing after your period is done like it should. User 693125, I heard cortisol stress affect varicose veins. Okay. It could be, that could be. So why not work on some mind-body medicine, some meditation, some breathing? Jen Av, what about blood cancer? Jen Av, off the top of my head, blood cancer is not a reason to not take hormones. The only hormonally sensitive cancers are breast cancer, advanced stage melanoma, and also advanced stage uterine cancer. So not stage 1 uterine cancer and not a history of a distant melanoma. So that I know of, and again, it depends on what blood cancer you're talking about, but I'm not aware of a contraindication. Now, again, it depends on everybody. JBK, how do I know what progesterone I should be taking? Prometrium is the trade name for micronized progesterone. If it's anything other than that, if it is medroxyprogesterone acetate, Provera, Agestin, levonorgestrel, norethindrone acetate. That's not progesterone. It's a synthetic version. Okay, what is your opinion on taking estrogen or troche? So, Marcy, sometimes we do use the troche. We generally don't like to give estrogen orally, which a troche is not orally, but if you put the troche in and then you chew it and swallow it, that's oral. If you're really disciplined and you let it completely dissolve, that's sublingual. So I do have a few people who take it that way. Oh my gato, why are shoulders affected? So interesting. Yes, I've had so many more people have this frozen shoulder. So why that is because estrogen is anti-inflammatory. And so the lack of inflammation, if you're predisposed, is going to manifest as some kind of joint issue. Sometimes it's people that have knee issues, but it seems very commonly that women are presenting with shoulders. And I think that was studied and reported. So yeah, it's interesting that, and I think through social media and you guys sharing your experiences and everything, more and more people are finding out about this. Okay. JBK, so it's good. Progesterone is good. Yes. Cool grandma, how long does menopause last? So menopause is defined as the time when you have been 1 year without a period, and that lasts until you die. You're in menopause for that. Now, going through menopause and the menopause transition can be, perimenopause can be 10 plus years. So it can be a lot longer than that. But the definition of menopause is from when you stop your period until you leave this earth. Okay, Sonia Gonzalez, I have a frozen shoulder and my legs hurt and feel super heavy. Yeah, that sounds like inflammation. That could be a lack of estrogen. Michelle, how common is burning mouth syndrome in perimenopause? Very common. It's more often from a low DHEA or low testosterone. So it's not as much the estrogen component. So you certainly could be suffering from that in perimenopause because those hormones can drop even before menopause. Okay, let's see. You guys have got a lot of great questions today. There is a question here from YouTube. Hello, doctor. I have a fibroid and just started HRT. Is it okay to be on HRT? Well, first of all, it depends on where the fibroid is and how big it is. But in general, having a fibroid is not a reason that you can't take hormones. So we just keep an eye on it. And I'd really be interested, is it inside your uterus, outside your uterus? How big is it? But no, it's not a reason that you can't take it. You should still be able to take it. And thank you, you guys who are sharing the live. I appreciate it. For those of you that are just tuning in and weren't here when I started, I just was talking about all the new free resources that we've been working on. If you haven't checked out my bio and checked out my new free resources, we have a guide to testing. I get a lot of questions on testing. I've just the last 2 weekends been traveling to teach doctors about what to test and when to test. So we've compiled for you guys a free guide to testing. The link is in my bio. And if you're watching on YouTube, the link is here in the show notes. The second thing, natural therapies for anxiety and mood issues. Check that out. Sign up for our free newsletter. The link is in my bio here. That comes out most Tuesdays, unless I'm traveling. And so that is to alert you about our lives that we're doing. We also have a free mini course that we've reformatted for you to check out. So those are all those free things. And sign up for our newsletter too, so we can make sure we're getting the content to you that you want. And who knows what's going to happen with TikTok, right? Meow, I'm 54 and I still get a period every month, but get crazy cramps right before. Yeah, so that's more common a symptom of low progesterone. It's funny because when you first start your periods in puberty, you have low progesterone and you have a lot of cramps, and then they kind of get better because you have an okay amount of progesterone. And then when you get to perimenopause and your progesterone drops, a lot of times people are like, I've got cramps, just like when I was a kid. So that could be a sign that your progesterone is changing. Okay. So anything else that I wanted to tell you guys? Let's see. All about the free resources. If you haven't checked me out and subscribed to my YouTube channel, make sure you head over it. Go right now and head on over there and check out the free resources. The list is there for we also have a hormone quiz. If you're not sure if you're having symptoms, there is a quiz. Trying to figure out how to tabulate it and get that back to you though, but at least we have the list of the questions to ask. So maybe you can discuss these with your doctor as well. Dank Dame Nina, I'm 45 and in menopause and I have horrible acne out of nowhere. So that's a funny one too. Not funny, haha, but like if you have acne when you're a teen, why do you have it again at the end of your reproductive cycle? It's because when your estrogen drops and the ratio to your testosterone is lower, that's when people get acne. So that could be too. I mean, I didn't have acne as a teen, and then in my 40s, I started having problems with pimples, and it's so frustrating. Um, Natalija Dawson, how do you feel about evening primrose oil? Should I be taking it all day or certain times? Great question. It's funny because the name would imply that you have to take it in the evening, but I don't know necessarily that you have to take it in the evening, but I think it's got pretty good data. Some people really think it helps symptoms of PMS and hot flashes. Also, some good data on fish oil as well as saffron for some of those menopausal and perimenopausal symptoms. But I don't have anything bad to report about evening primrose oil. I think it's a good therapeutic option for a lot of different types of symptoms. Other things that can really, really help just in general, the menopause transition is magnesium. Usually we tell you to start with 400 milligrams in the glycinate form. Magnesium helps over 400 enzyme processes in your body. It's another one that I really like. B complex vitamins. A lot of us are B deficient. So that can seem to really help your neurotransmitters and your processing estrogen. Cool Grandma, how to tell the difference between perimenopause and menopause. So perimenopause is when you're still having cycles, but you are skipping or your cycle is late by a week. That's perimenopause. You're not in menopause until you've gone 12 months without a period. Then it's definitely menopausal. So that's the definition of menopause. So again, using that definition, you could be in perimenopause for 10 plus years. Tarina Moore, I'm an HRT and I've become very angry, snappy, and irritable. So wondering what you're taking, if you're taking micronized progesterone, then that generally helps moods. If you're not on the right dose of estrogen, you could be snappy, or if your testosterone's low too. So I'm not really sure, Tarina, you probably should get your hormones checked to make sure your levels are all good. And I wonder if you're on bioidentical hormones or if you're on some kind of synthetic version. Olga. Oh, Olga, Tara, I just want to thank you. I found you in Forum Health in Illinois, and I got my light back. Thank you so much for your kind words. I love hearing that people that we're helping people. That's what it's all about, right? And that's kind of why I'm here on a Tuesday night when I'd rather be, I only got 4 hours of sleep last night because my flight was late. So I would actually rather be kind of laying on the couch. But, for you guys, if I can answer a few questions, that's why we spent all this time and resources trying to get these free resources for you as well. Okay, Bridget, what about short periods? Short periods in your 40s generally can be because of low progesterone, but could also be low estrogen. First, it's because of low progesterone. Oh, Tarina, you're on bioidentical. So it seems like the dosage could be off on what you're taking, and that could be why you're having that estrogen, progesterone, and testosterone. Yeah, I wonder what the dosage are. I mean, it could be too much testosterone too. Stephanie Simmons using pellet therapy and not appreciating the inconsistency of estrogen in the system. Yeah, that's the issue too, is the big highs and big lows, because theoretically it would be great to just have your hormones inserted and never have to worry about taking anything. But I haven't seen that it's like constant enough. So yeah, I like patches I use a patch and I like it. And I went again to Mexico this weekend to work, and I thought I forgot my patches, which I actually, after I was 2 days late changing them, I found them when I was unpacking, which I couldn't believe I would have forgotten them. But anyway, so if you are consistent with them, you have a more consistent estrogen out. Okay, I'm starting estradiol patches. Can I keep taking my depot shot 150? Kathy, if you are trying not to get pregnant, you might need the depot, I guess. I'm just not a fan because of the link to bone loss with that, and also it's suppressing your ovaries. So if you take estrogen, yes, you have a progestin, but you don't have progesterone. So you're not getting the full benefit. It's like, if I gave you rice for dinner, like rice is like a vehicle for sauce. You're not getting like the stir fry and the sauce on the vegetables. You're getting like part of the meal if you're just taking the depot and then you're getting the estrogen. So you're not getting all the benefits. You're not getting bone health, brain health. I mean, I guess you are with the estrogen. What vitamins should you take if you're in menopause? I think I actually have a video on that in here on TikTok. But the top things I think women in menopause or perimenopause need are magnesium, vitamin D. Sometimes I say a probiotic. Probiotic can be helpful, and also B complex can be very helpful. Those are just your maintenance, good for health things. All right, I think I can take a couple more questions, and then I'm going to have to call it a day because my battery is almost out. Okay. Sweet pea, if I take a break from the estrogen cream, can I still take the Prometrium? Yes, I think that's good because cream can accumulate, and I think it's good to take, a day a week off. But you can still take the progesterone. Okay, Katie, supplementing with low estrogen. Do you think that's okay? Now I'm trying to go back to Katie and see what you were taking that you're supplementing with low estrogen, because I don't see a previous question from you, Katie, about what you're supplementing with low estrogen. Low estrogen is a birth control pill. Oh, I think it filtered your first comment. Yeah, I didn't get it. It's funny because someone just said that they're filtering comments. I don't know how that is, because sometimes people would be like really frustrated with me that I'm ignoring their comment, but I wasn't seeing it. Now I know that it's probably because it was filtered. So, yes, I don't think I have your first comment, Katie. Can I take Equel with my bioidentical pellets? Tarina, I don't know what Equel is. Viz, thank you. Oh, yes. Check out the videos. Check out our free resources. Katie, let's see. I don't see your comment. Sonia says, if you have thyroid issues, you might want to think about selenium 200 micrograms. I live in Florida. Can I be a patient? I had a Florida license that's expiring, but there is a Forum Health in Tampa that you could go see, but I won't be able to see you for hormone replacement. Yeah, Katie, the beginning of your question did not get here what your first comment is, what you're supplementing with. But low estrogen is not a hormone replacement. It is a birth control pill. It is formulated to prevent pregnancy. It is not bioidentical hormones. I don't believe it's going to supplement your hormones. It's going to manage symptoms potentially, but I don't think it's not my choice. Marcy, I get horrible anxiety around the time of my period, just before. What can I do to fix that? Things that can really help your anxiety are things like magnesium, fish oil, but it sounds like you have a low progesterone. Thanks, guys, for tuning in on Tuesdays. Again, for those of you that joined us late, check out our free resources. Sign up for our newsletter. Check me out. Please subscribe on YouTube, on Tara Scott MD, Hormone Guru. You'll find me at Hormone Guru MD on Instagram. We have just spent a lot of time and resources to get you a new quiz on hormone symptoms, a guide to natural treatments for mood issues in perimenopause, and a perimenopause testing guide that you can print out and take to your provider. We also have a free mini course for more videos and an easier to find place. So check me out here on Tuesdays. Thanks for joining in. Lots of great questions today. And I hope you guys are enjoying that we're finally in spring. And to those of you mothers out there, if we are blessed, have a great Mother's Day on Sunday.